All right, welcome back. In today's Town Square, a healthcare campaign 55 years in the making. Michigan Congressman John Dingell, the longest-serving member in the House. He first arrived on Capitol Hill in 1955, filling his late father's seat at the young age of 29. Since then, it has been his lifelong mission to provide affordable health coverage to all Americans. So we were wondering what his thoughts were on this particular bill at this particular moment. And Congressman Dingell joins us now from his home away from Capitol Hill. It is actually his home, effectively, Capitol Hill. Congressman Dingell, a pleasure to see you. What are your initial thoughts as you look at the next few days and weeks here?
Well, first of all, happy St. Patrick's Day.
And to you, sir.
But second of all, this is the beginning, I hope, of a great period in American history. We're going to pass a significant reform of American health insurance and American health care. We're going to see to it no longer can they cancel your policy because of pre-existing conditions, that no longer can they rescind your policy, that no longer can they engage in these curious practices where you don't understand what the policy says or where you have no right of appeal, and where there are reasonable controls for the cost.
And how do you respond to those who look at that list quite admirably and say that sounds like a fantastic patient's Bill of Rights and is very appropriate, but is not fundamentally reform of the health care system, which, as you know, is very expensive and has a wide disparity in both quality and availability? Well,
first of all, it is health reform. But second of all, we're going to do a whole lot more than that. We're going to see to it that it is affordable. We're going to see to it that it is accessible to all of the American people. We're going to see to it that for the first time, American citizens are going to know that their policy can't be canceled. And they're going to know that they're going to have access to insurance on a competitive basis. And they know that it's going to be insurance which will mean something to them rather than being unaffordable and inadequate care that they're going to pay too much for.
And Congressman, I can't think of a single person in America who would not aspire to everything that you just listed and agree with it. However, it is not clear to many that what you just described is actually in this piece of legislation because of the inaccessibility of the exchanges to most Americans, because of the perpetuation of the insurance monopoly, because of the bias toward expanding coverage and the limited or perceived limited basis upon which the actual industry is meaningfully reformed.
Well, first of all, the industry is going to be reformed because the exchanges which will be set up will require that the industry to sell that insurance through those exchanges, which are going to be open, will be done in a way in which the citizen will not only know what he's getting, but have an opportunity to know that there is fair competition there. And this is the mechanism through which we are going to see to it that price increases stop, or at least are controlled. In less than 10 years, history will repeat itself, and health insurance will double another time to $25,000 for a family. Ask yourself, who can afford that?
Sure. I guess one of the concerns is the limited accessibility of those exchanges. In other words, it's one thing to create a marketplace, but if you create a marketplace that is not accessible to most Americans, how effective can it be?
Well, first of all, every American who wants will be able to keep his insurance. Second of all, every American will have access to the insurance exchanges. That right is guaranteed in the legislation.
If you were to look, and my understanding is that the only people that have access to the exchanges are those who are unemployed or in a small business.
No.
Is that correct?
No. Any American will have access to the exchange.
Okay.
Small businesses, large businesses, people who are unemployed, people who are employed, people who have lost their insurance, people who have no insurance, all will have access to the exchange. This is another of the fictions that is being put out by the opponents of the legislation.
Understood. So if you were to look at the public option and the Grayson Amendment that he is talking about proposing, where he's looking to make Medicare effectively available to all as an amendment shortly following the piece of legislation that's already under consideration, and effectively make it so you could buy your health insurance from Medicare as much as you could buy it from a Blue Cross Blue Shield. Do you think that amendment is a good idea? Would you be in support of it? And do you think it might pass?
Well, I think it's a good idea, but let me remind you, I have been fighting for single payer. I was fighting for the public option. I am still fighting for it. I was fighting to see to it that we would have a lot better controls than we do over the behavior of the insurance companies. But understand that legislation is a gradual process, and we have to take the best we can get to see to it that we make progress. Remember, it is about every 20 years on the average that this opportunity comes to this country. And I don't want to see to it that Americans have to wait through another disastrous 20 years when they have inadequate care, when they can't afford health care, when 47 million Americans have no health care, when they can rescind your policy or when they can deny you care because of pre-existing conditions. I don't want any more of that. We're going to do the best we can to address as many of these problems as we can and look to the well-being of the people of this country instead of the well-being of the insurance companies.
I want to take advantage of the opportunity that I am able to speak with you this afternoon to talk a little bit about the bumps and bruises that the reputation of our legislators has taken over the past couple of years and the role of money in politics. Do you think that the negative view of those in our Congress is appropriate when you look at the legislative process from your perspective and in the context of previous decades?
Well, the only perfection that we as humankind will confront will be when we, I hope, all go to heaven. The hard fact is this is a human world full of human faults. Is there too much money in politics? Absolutely. Did the recent action of the Supreme Court allowing corporate contributions to campaigns, was that a good thing? Absolutely not. It was an abomination. And it means, for example, that the Iranian Guard-controlled corporations can now contribute to American campaigns. It means that Norinco, the Chinese arms manufacturer, can contribute to American campaigns. And there is altogether too much money in campaigns. They go along too long. And the only way we have been able to address this so far has been to impose basic limitations on the amount that could be expended and to see to it that we had publicly financed campaigns for the presidency. In addition to this, we've tried to see to it that we have revelations and openness with regard to who it is that contributes and how the money is spent. But clearly, as you agree, I think this is an inadequate situation, and it's going to be made much more difficult in view of the very evil decision that has been brought forward by the Supreme Court recently.
Congressman, thank you so much for your time this afternoon and for your efforts in our government all these years. Thank you, sir.